Welcome, medical students, to today's lecture on autoimmune hepatitis. We will explore its pathogenesis, diagnosis, treatment, and prognosis, including genetic factors, immune cells, serological markers, pharmacotherapy, and more. Let's expand our knowledge in this fascinating field together. Autoimmune hepatitis is a chronic inflammatory liver disease characterized by the presence of autoantibodies and elevated serum immunoglobulin levels. It primarily affects women, with a female-to-male ratio of approximately 4:1. The exact etiology of autoimmune hepatitis remains unclear, but it is believed to result from a combination of genetic susceptibility, environmental triggers, and immunological abnormalities. The immune dysregulation seen in autoimmune hepatitis involves the activation of autoreactive T cells, which recognize self-antigens in the liver and initiate an immune response. This immune response leads to the destruction of liver cells, resulting in ongoing inflammation and fibrosis. The precise self-antigens targeted by autoreactive T cells are yet to be fully elucidated, although several potential candidate antigens, such as liver-specific cytoskeletal proteins, have been identified. Genetic factors like HLA genes, immune regulation genes, CTLA4, PTPN22, and FAS, and drug metabolism genes, CYP2D6, CYP1A2, contribute to autoimmune hepatitis development. Certain alleles increase the risk, while others decrease the risk. These genes also affect the response to treatment. The immunopathogenesis of autoimmune hepatitis involves immune cells, CD4 plus T cells, NK cells, and CD8 plus T cells, and cytokines, IFN gamma, IL-17, TNF alpha, IL-2, and TGF beta, that contribute to liver damage and fibrosis. Targeting these interactions may lead to new treatments for autoimmune hepatitis. Accurate diagnosis of autoimmune hepatitis relies on clinical, laboratory, and histopathological criteria. Clinical signs include fatigue, abdominal pain, jaundice, and hepatomegaly, with varying severity. Laboratory tests show elevated liver enzymes, immunoglobulins, and specific autoantibodies. Histopathology confirms the diagnosis and assesses liver damage using scoring systems. Serological markers like ANA, OSMA, and anti-LKM1 antibodies are important for diagnosing autoimmune hepatitis. ANA is commonly detected in 80% of cases, while OSMA is specific to autoimmune hepatitis. Anti-LKM1 antibodies are specific to autoimmune hepatitis type 2. These markers help differentiate autoimmune hepatitis from other liver diseases. Histological evaluation of liver biopsy aids in diagnosing and classifying autoimmune hepatitis. The main feature is interface hepatitis, with lymphoplasmacytic infiltrate at the portal tract. Other features include hepatocyte necrosis, lobular inflammation, and fibrosis. Scoring systems, like EIG criteria, help guide treatment and assess response. The primary treatment for autoimmune hepatitis is immunosuppression using corticosteroids and azathioprine. Corticosteroids suppress the immune response, while azathioprine inhibits immune cell proliferation. Close monitoring is essential to manage side effects and treatment effectiveness. Alternative immunosuppressive agents may be used if the initial treatment is unsuccessful. Liver transplantation is a life-saving option for patients with end-stage liver disease due to autoimmune hepatitis. The indications for liver transplantation in autoimmune hepatitis include acute liver failure, decompensated cirrhosis, hepatocellular carcinoma, and suboptimal response to medical therapy. Overall, liver transplantation has excellent outcomes in patients with autoimmune hepatitis, with 5-year survival rates exceeding 80%. Transplantation effectively addresses the underlying liver disease and restores liver function, providing patients with an improved quality of life. However, challenges exist in the post-transplant period. Autoimmune hepatitis can recur in the transplanted liver, leading to graft dysfunction and potential graft loss. Close monitoring of liver function, immunosuppressive therapy optimization, and timely intervention are essential to manage and prevent recurrent disease. Autoimmune hepatitis is frequently associated with extrahepatic manifestations, which can involve various organ systems. The most commonly observed extrahepatic manifestation is autoimmune thyroid disease, including both hypothyroidism and hyperthyroidism. Systemic lupus erythematosus, SLE, and autoimmune rheumatic diseases, such as rheumatoid arthritis and Sjögren's syndrome, can also coexist with autoimmune hepatitis. The presence of these extrahepatic manifestations adds to the complexity of patient management and necessitates multidisciplinary care. The underlying mechanisms linking autoimmune hepatitis with these extrahepatic manifestations are not fully understood. However, it is believed that shared genetic susceptibility, dysregulation of the immune system, and environmental factors contribute to the development of multiple autoimmune diseases in affected individuals. Risk factors for autoimmune hepatitis include being female, younger age at diagnosis, and certain HLA alleles, HLA-DR3, HLA-DR4. Prognostic factors that influence disease outcome include delayed diagnosis, advanced fibrosis or cirrhosis, severe liver injury, and non-adherence to treatment. Regular monitoring and adjustments to therapy may be necessary. Autoimmune hepatitis during pregnancy requires careful management to balance disease control and the well-being of both mother and fetus. Corticosteroids and azathioprine are generally safe, but monitoring and adjustment of therapy may be necessary. Multidisciplinary care is crucial for optimal outcomes. Advancements in autoimmune hepatitis research have led to improved understanding of pathogenesis and treatment. Novel immunological targets, specific immunosuppressive agents, and personalized therapies are being explored. Genetic factors, biomarkers, and biologic agents offer hope for better management. Precision medicine and data analytics hold potential for personalized approaches. Autoimmune hepatitis is a complex disease that requires a comprehensive understanding. Knowing the diagnosis, treatment options, and extrahepatic manifestations is crucial for optimal patient care. Stay informed to improve outcomes and quality of life. Thank you for watching.